Lara, and I'm an antibiotics pharmacist. And as Lawrence has already introduced, I'm here to bring this poster that is planned to display in the public to raise awareness of if you have a penicillin allergy, it might not be true. And if it's not true, it might cause harm. Um, and I'm sharing it now on the screen. Is it actually displaying on the screen?
Yes, it is.
Yeah,
Yes.
okay, thank you. So before I go into the details and get comments for this poster, I just want to give the members a bit of background how we come to decide making this poster. So there were studies done, and it shows that only 1 in 10 people with penicillin allergy are actually truly allergic to penicillin. And when these 9 patients are not truly allergic to penicillin, there's harm might become to it. There is increased risk of deaths, and because they might not be able to use the first line antibiotics that work best for infection, for most difficult to treat infection, and also they might stay longer and spend longer time in hospital because of longer recovery, and need alternative medication that those might cause more side effects. So those might be the reason that it might cause harm with false penicillin allergy. And the group recognized that, and we decided to set up a task and finish group in the end of December 2024 to look at how we can support other healthcare professional to identify this patient correctly. Because at the same time, if it's true penicillin allergy, we want these patients to remain having a record, because if you have a true penicillin allergy, having penicillin can be life-threatening as well. So we need a robust process based on evidence that's identified these patients might not have true penicillin allergy, and try and remove this record so that we reduce their harm in the future. So this group has come together, and we have drafted a guideline with good practice in guide recommendation within the guide, and an assessment for healthcare professional. But comes along with it, we also have these poster that plans to display in public to raise awareness so that people will ask their healthcare professional for assessment. And when they were when they will be contacted, there is also patient information leaflet and text messages sent to the patient identify that eligible for assessment. But I thought that's quite a lot to overwhelm you, so I will get some feedback for this poster, and then after this meeting we'll circulate the patient information leaflet and the text messages that you might get from your GP, and get some comments after. So as I said, this poster, the aim is to highlight to the public that if you have a penicillin allergy, you're not sure, go and ask your healthcare professional to assess whether it's a true penicillin allergy. There could be a multiple reason, even if it was true allergy in the past. They might wean over time, or it could be a side effect that they experienced before instead of allergy. So that there could be multiple reasons why it might not be a true allergy. But the purpose of this poster is to raise awareness so that people will go and ask for assessment. So is there anything you want to add, Dr. Bray?
Sorry, just trying to unmute myself. No, Clara, not really. I think it's just the important change, I suppose, with time, where everyone in the interest of patient safety had, if there's any doubt, declaring a penicillin allergy. But I think now we know, and hopefully this poster gets across the message that a penicillin allergy label, where it is not true, can actually bring unnecessary kind of harm to people. And I think that's where the paradigm has shifted on this. So yeah, thanks, Clara. That's all I'd just like to add.
Well, thank you. I'll open it up for discussion. Just a quick question. So if you do ask your healthcare professional, What's involved then in the testing if you have whether you have an allergy or not?
Should I quickly show our guides that we drafted? So it will go to another group for consultation, and this consultation will be out in middle of January. Kat, is that right?
Yeah, that's right. So yeah, PAPIG members will obviously send an email out to let you know once this is out for consultation. But yeah, early to mid-January, we're hoping.
Yeah, so we have got a flow chart for GP. So if you ask your GP, that is like ad hoc review or request by patient, then they will bring out this one-page assessment. And this assessment is based on evidence that depending on this answer you gave, it gave you a score, and the score will determine how much chance you really have a true penicillin allergy. And then it goes to section 2, asking specific question to identify whether it's a non-allergy reason or is it a true allergy reason that you were labeled penicillin allergy. And then after this discussion, the healthcare professional will make a recommendation of either immediate remove label, we call it delabeling, or they will say that it looks like you have a chance that it might be too high to just remove label based on the history. You might need further tests, but that test may or may not be available depending on the area you are in Wales. So there's different options that they might offer depending on local availability. And the assessment looks like this one-page assessment. So they will ask these 4 simple questions on how long ago was the penicillin allergy, was it anaphylaxis, difficulties breathing, severe skin reaction, did they need any treatment for it? So those questions will give you a score, and it will only proceed when they score 0, which is very low risk, less than 1% chance that it is a true penicillin allergy. And then we go on to the second bit here to ask specific question if it's a very low risk patient. Does that answer your question?
Yes.
Yeah.
Yeah.
And I forgot to say in other settings, so that I only mentioned about GP. So if it was in other setting, like in a hospital setting, and it will be a very similar process. So they will go through these assessment as well, but then it's just the documentation side for the healthcare professional is different. But in terms of the public and the patient, it's the same set of questions that they will be asked.
Okay, no, that's really helpful. Oh, sorry, I could hear myself echoing back. Just sorry, another question from me. So are GPs going to be proactively looking for patients that are marked as allergic to penicillin on records?
So this is a guidance that they can do it. So there is no scheme at the moment that they will actively do it, but that is in our plan that we try to encourage them to do it after having a guidance, because without having a guidance, then they will be feel less supportive to do it. So we'll open one step at a time to have a guidance first, and having the public asking for it. If it's demand from the public as well, they will be, I think, more willing to have this service in.